Good morning, everyone. This is Daryl Reinicke, CEO at Westhills Village. Today we put out an updated letter to all the independent living residents, and we again continue to contact and visit with our families in our licensed facilities, as well as the residents and of course all of our staff. Thought I'd do a brief video on a number of positive things happening, as well as an update of course, the subject of COVID. And I want to just start again and say we greatly appreciate everyone's support, your patience, your cooperation. It's certainly trying for all of us, and that would be you as residents, your families, those of us who work here, and our families as well. So some good news is this week, or next week possibly, Bank West will be here to open up. We'll be getting more information out on days, hours, and how you'll be able to access their services. Also, knowing that we'll be continuing this for a while, we are looking into some other opportunities of how to communicate with you during resident council meetings, and as well as of our upcoming budget meeting that we'll have either the end of July or first part of August to stay connected with all of you folks. We're excited to announce that we have a blood drive going on. That'll be here August 4th, so if you're interested, contact the front desk. There's a great need for blood right now as surgeries are being started around the nation, so we'd like to be able to support those efforts if possible. Of course, this week we had a hailstorm, and I did have an adjuster up, and it does look like we're going to have enough follow-up work that will involve our insurance company, and I've already been in contact with them. So shortly we'll see some more people on top of the roofs, walking around the buildings, doing an evaluation, and then at that time you'll see additional work begin for that follow-up. I don't have an idea today what that might entail and or when it might occur, other than we know there will be some work coming up on that. Would encourage you that if you're so inclined, we'd love to have your support for the Best of the Black Hills voting that's going on in the categories of independent living, assisted living, skilled nursing. We're also very excited that we put on Touchtown photos of our new 5-star plaques that we received. We have one at Clarkson and one at Westhills. You know, we have, at times it almost seems like we've become numb to that, because we have always been a 5-star, as well as Clarkson. And I would tell you that many facilities across the United States hope to achieve it someday. We've always been one, and we'll work hard to continue that. So great shout out to our staff members and managers who we team up to make that happen. Also continue to check our website. There's a lot of information there for you, for your family, for people in the community. We continue to hear that families really enjoy it, but I shared with a lot of people this week that I get calls. In fact, I just had a call this morning from someone who was on our website, and they kind of use that as their guide of what to do with COVID. So I think we're doing a good job of that. So on the subject of COVID, again, so far, all staff and residents, we do not have any COVID-19 in our facilities that we're aware of. On a weekly basis, we do resident and staff testing in Clarkson Healthcare, Westhills Healthcare, as well as the Courtyard. And all of that testing, again, has been negative, and we'll continue to do that as we're directed. Nothing much has changed. You may have heard about a phasing plan that the Department of Health has put together for facilities like us to start to do something different. And where we as a facility have everything in place and going the right direction, the one thing that is not in place is a significant decrease or COVID-free in the Rapid City community and Pennington County. And that's one of the key elements before a facility starts to make changes in their visitation and all the other protocols that we practice, is that the community that you're in has to show and have some time to show that COVID is decreasing or disappearing, and that is not the case out here. I'm sure all of us can also think about, with tourism increasing, with maybe people's practices not as Stringent is what we would like to see out in the community, and with some big upcoming events, including the Sturgis Rally, what are the chances that we might be at these numbers for a while yet? I think we all recognize that those are some pretty big hills to get past us before we probably any of us would expect numbers to start coming down in our community. But I would tell you this, the minute that we feel that we're in a position to make a change, we will be doing that and communicating that with you and your family members alike. So continuing today, visitation is in place. We want to stress to everyone here to please practice the key elements that prevent you from becoming sick and you protecting others from becoming sick with COVID is wear a mask, wash your hands, and practice social distancing. As you look around the nation and see the communities who are getting away from that, their numbers are coming right back up. And that is the only tool we have in our tool bag, folks, to fight this. There's no medication, there's no vaccine, and trying to address it after it gets started is a monumental effort. Practicing the steps to prevent it is going to be much easier on all of us. And as I talk about that, there's really only two options that we have. And as I've explained to others, one is we continue to practice the steps, have the protocols in place for prevention, or if we get away from those steps, our efforts will be dealing with COVID. And that's our two options, and we have all selected, I think, to work harder on prevention than working harder on how do we deal with it once it's in our facilities, affecting you as a resident, potentially your family and friends, and certainly our staff. You know, the last thing I wanted to mention is that I've been asked, do we have a plan in place if or when? And yes, we do. So we have multiple plans in place of what we would do if we had COVID at Clarkson, COVID at our healthcare, COVID at the courtyard, or COVID in any of the independent living areas. The plan is different based on the location. The plan is different based on how many people, and the plan is different based on the condition of residents. So we certainly work very closely with our medical director and Monument Health, for that matter, on all the what-if scenarios, how we would deal with it, and we have very good plans in place. But I would share that if we ever had a significant outbreak in the independent living, you know, the additional steps we would take within hours would be closing the dining room, and everyone would receive a meal at their apartment door, discontinuing all activities and events, discontinuing any resident accessing the commons. Housekeeping services would be discontinued because we wouldn't want people going in, and basically everyone would be quarantined in their apartment until the facility became COVID-free. That is what we're working so hard to prevent, and why it's just critical that we have your support. You've heard all the statistics of how many people get it and don't realize they have it, or that they'll have it for 4 or 5 days before they become ill. That would tell them that they should not be leaving. So our practice is, we all have to kind of practice that, what if we had it, how can we prevent it? And I can tell you our staff is 100% on board, and we're working very hard at that, because we don't want you to become ill, and we certainly don't want to share it with one another at work. So we've gotten 5-star status on our efforts from the Department of Health as they have come and reviewed us. And again, we're a COVID-free facility. We're not sure how long that could potentially last, or potentially that we have a scenario that we would have to address. But again, the idea is to prevent, and then also minimize any effect to the facility and to the people who work and live here. So again, I want to thank you. I know it's long for all of us. There aren't any other good options other than to be safe. So we appreciate your cooperation. We appreciate your input. And again, if you have specific questions of, can I do this and how does that apply, go to the front desk. They may not be able to tell you the answer, but they'll find the person who can. So thank you again. We're hanging in there well. We just need to keep doing this until the signs show that we can do something different. So thank you again.